facilitator for the session today. We're going to go on and ask that everyone go on and put their county in the chat. That really helps us get a sense of who's in our learning community and how we can also direct some of the comments to the various counties, and also helps us get a sense. We've had lots of folks ask us the number of individuals that come from different counties. So if you could go on and put that in the chat, that would be very helpful. So we usually at this time, before we begin our session that we'll be having, which will be very interesting on the impact of COVID on voting, we usually give a COVID-19 update. And the COVID-19 update comes typically from Christian Furman, our medical director at the Traeger Institute, or Laura Morton, who is a medical director at several nursing homes and the division chief for geriatrics at the University of Louisville. Unfortunately, Dr. Furman is doing hospital service, and Dr. Morton is actually part of our Project ECHO that we are launching with about 150 nursing homes in the state and some of the surrounding states. The focus of that Project ECHO is on trying to impact infectious disease control related to COVID in the nursing homes. So the two of them have dubbed me proficient to be able to give the update that they would give. So these are the notes that they have sent to me that I will share with you. So the notes come from Laura and Christian based on Governor Beshear's hour last night. There are 225,000 deaths in the United States, and hospitals are up. The hospitalizations are up across the United States. This is the third surge being experienced around the world. There is a 14-day travel advisory quarantine for multiple states with greater than 15% positivity rate. Kentucky had 9,335 cases last week, and the hospitalizations are going to follow the increase in cases. So Kentucky had the highest new case numbers Friday, Saturday, Sunday, and Monday. Monday, that was yesterday, we had 953 new cases. There were 3 new deaths, and the positivity rate is at 5.84%. There are 858 hospitalized individuals with COVID. There are 253 individuals in ICU in Kentucky and 112 individuals on ventilators. Nursing homes are starting to test 2 times a week due to the positivity rate greater than 5%. And the long-term care facilities are really beginning to feel the impact at a more intense level as a result of that positivity rate in the state of Kentucky. So there are, if your county is in the red zone, which I can put a link to where you could find whether your county is in the red zone. The red zone recommendations include the following: that employees that can work from home should work from home, that non-critical government offices to open virtually, that there should be a decrease in person shopping for those individuals living in the red zone in Kentucky, that we should focus on ordering takeout from restaurants and not sitting in restaurants for counties in the red zone. We should reschedule, postpone, or cancel public and private events in the red zones. We shouldn't host or attend gatherings. You should avoid non-essential activities outside of your home. Reduce activities and contacts in the red zone. And Dr. Christian Furman also indicated that we really should focus on being concerned about that as we approach Halloween over the weekend. So I thank Laura and Christian for that update and sharing those points with us. Now we're going to turn to our guest speaker. We are excited to welcome our guest speaker, Jared Daring, the Executive Director of the Kentucky State Board of Elections. Mr. Daring will lead a conversation exploring voting and how it will look different during COVID-19, as the executive director of the State Board of Elections, Mr. Deering will be able to give us a unique perspective and clarity to our democratic process during this nationwide pandemic. And based on some information that came out yesterday, I think about some of those 100 ballots that were burned yesterday, I'm sure you have much to share with us. So I'm going to stop sharing, and you let me know when you would like to share. Or Sam Cotton, could you tell me if Jared has sharing?
Give me just a second here, and he should be able to share now.
All right, Jared. So when you are ready to share, you are welcome to do so. And when and for individuals that have questions, please go on and put them in the chat. We do have 13 individuals at this time in our presentation, so we might be able to just turn on mics and be able to have a conversation that way. So we'll see as things go on. All right, you have the floor.
Well, I was wondering first if you might maybe just give me a little bit of enlightenment of kind of like who the general population of the call is, and kind of what the demographics that we were kind of talking about. Is that I can tailor a little bit more specifically to kind of needs of the audience in the group?
Well, we have a variety of different disciplines with us. We have, as well as we have students. We have individuals that are, we have a provider, a primary care provider. We have a couple of acupuncturists. We have an exercise physiologist with us, some marketing specialists. We have program managers, individuals from different managed care organizations, and sometimes we have individuals from the Area Agency on Aging. So we have both individuals that are, all of us are voters, all of us are professionals, some of us are residents. So sometimes we have individuals from Area Agencies on Aging. So I assume that over the next 5 minutes, more individuals would join. Does that help?
All right. Yeah, absolutely. Absolutely. It does. Appreciate it. So I think one of the things that we can probably start with discussing is, so the election's a little bit different this time. That is kind of a good starting place to kind of just describe what changes we made in the election and kind of why we made them, and what we kind of based those changes on. So a lot of the changes that we made for the general election were based on the changes that we made in the primary election. So Kentucky is really fortunate in that we have a mechanism in statute that allows us to, when the governor declares a state of emergency, the governor or the secretary of state can then request a change in the manner of the election due to that emergency. And then the State Board of Elections, which is an independent agency. We are one of 4 independent agencies in the Commonwealth. We don't answer to any constitutional umbrella. We don't serve the governor or the secretary of state. I serve at the pleasure of an 8-person board. That board is made up of 4 Democrats, 4 Republicans, 2 of whom are retired county clerks, so that there's a basis of knowledge and understanding from an administrative level that helps guide the board as well while we're in session. And then the board obviously is led when they are not in session. I govern the board and the staff, and try to effectuate positive steps in the running of our elections and governing of our elections. So we had this ability to be able to, one, postpone our election for the primary election. And one, what that did is give us some ability to kind of see how other states were managing the pandemic and what was going on in their states during their primary. Unfortunately, many states did not have the ability to postpone their primary elections. They were kind of stuck with what they got. I serve on several boards, one of which is the National Association of State Elections Directors. So I have a pretty good relationship with a lot of my peers around the 50 states, 5 territories, and District of Columbia. And we're in constant communication with each other, if not weekly, daily, oftentimes. So some states were able to come in. I'm thinking of the state of Washington. They literally had their primary the first week that those cases were starting to surge in Washington state. So everyone was kind of like breathlessly holding their breath to see, like, hey, how was that going to work out for them? They were kind of the first test balloon. They were fortunate, I think, to be able to get their primary in and completed before that first wave started to take hold, where the election wouldn't cause a super spreader event. I mean, that's honestly, I've got two concerns when I run elections during a pandemic. One is making sure that everyone has access to the ballot. That's our primary function. That's our mission statement as an agency. But moreover than that, my belief is that it's not only access to the ballot, but it's safe and secure access to the ballot. And if I can't provide those two things, then it's not a fair election. If someone needs to make a decision between, am I going to put my life at risk? Am I going to put my family's health at risk? And in choosing that decision, I may not vote, then we're not doing our job. And so that was the premise of what we kind of started this whole entire experiment at. We were fortunate to see Ohio go off, Georgia, several other states had their primaries before ours. And so what we were able to do is kind of glean what the best practices should be. And so what we determined were a couple things. One, that having normal precinct locations was probably not going to be super effective because so many poll workers were not showing up. In the state of Kentucky, it takes roughly 16,000 poll workers to operate our precincts during an election. And that's during a normal election. If you have a large scale election, like a presidential election, that number actually bumps up because you have to have alternates, you have to have additional staff, moreover than just the 4 that are traditionally at a precinct location. But of those 16,000, 9,000 are older than the age of 65. 5,000 are older than the age of 70, and 2,000 are older than the age of 75. And so obviously that, is the prime, risk demographic of catching COVID and having negative impacts on their health based on that age. So, that was our first kind of known problem that we were going to have to address, is how do we now replace so many of our poll workers that will just not be able to be there? And what we were seeing in other states, so for instance, Georgia, I know Georgia got a lot of national attention that, there were voter suppression or there were long lines. What a lot of people didn't realize is that for some of the lines that they were seeing in those locations, one, polling locations that just didn't open up because the poll workers decided on election day, not today, I don't want to go. So even though they had committed to being poll workers, they had gone through poll worker training, what we saw was there were some locations on average about 25% attrition for poll workers not showing up on election day. And then in some locations as high as 50 to 100% attrition, where that polling location quite literally had no polling workers that showed up that morning. And so now, how do you, as an elections administrator, how do you pivot that location and effectively be able to push voters through effectively at that location? And so, we always kind of joke that, we can fix the early voting, we can fix mail voting because you can pivot. You can see how things are going. You can start to iterate small changes to effectuate the policy changes you need to have an effective process. But election day, you kind of show up with what you have and you hold you white knuckle your chair arm basically the entire day. And so what we saw in these locations is, one, that these locations were not opening up. Two, that locations that opened up that were small in location, they tried to limit the number of people that would come in. Well, the moment you limit the number of people that come in, you decrease your throughput of voters, which now increase the line size on the backside. And in administrative terms, there's something we call the elbow of death, which is on in a queuing line. If you've got a line of people and you have every person has to check in, takes so much time to check in, at some point that line will get past a point where you can't get back over the hump again. And then that means there will be a line for the rest of the day, no matter what you do, unless you can increase the number of people checking people in. But when you've got a small location, you just can't do that. So what we were able to see is in these locations that the smaller location with poll workers that may or may not show up, with trying to social distance in a small location means you have fewer voting stations, right? Which means it limits the number of people that you have for throughput over the course of the day. So what we decided on was kind of this, not new methodology, but there are voting centers around the country where it's a large center where that jurisdiction where you have that contains the ballots for that jurisdiction. So in Kentucky, our jurisdictional boundaries are county lines. So every county will have ballot faces for that county. There are some states that have municipal lines, so that it's literally at the city level. But for us, so Jefferson County has over 3,000 different ballot faces. So in the past, it's been hard to have a vote center because you have to have 3,000 different ballot faces for the voting population, that when one person shows up, you need to be able to give them the correct ballot face that represents not only their precinct, but the splits that you have in that precinct as well. So that's always been difficult. But what we decided was, if we could manifest a large enough location that we could, one, social distance on the inside, increase the number of check-in booths that you have to check in voters, that you could separate the voting stations, socially distancing in an appropriate manner. And then ultimately, what you're now left with is a very large location that has access to all the ballots for that jurisdictional area. And voters can have a large throughput for that area while still social distancing. The other benefit is that we went from having, so let's just use Jefferson as an example again, 600 precincts, which Jefferson condenses those down to around 283 polling locations. So we would have had to have manned and staff 283 polling locations, right? Which, one, I'm not sure if those poll workers are going to show up. They're hard to manage remotely. You have to trust that the poll workers are going to do their job. So what we did is we took those and condensed them down into one location. So now that one location we could staff appropriately. We knew that we could have enough poll workers to man it effectively, that there could be management on site at all times. So if someone didn't show up, that's okay. You can kind of push and pull people around. If someone didn't show up, that's okay as well, because you can, again, just kind of swap someone in. But now you've got a site that's guaranteed going to open up. You've got a location that is easy to social distance. You've got access to all your ballots. And we can have a really effective way of making sure that the location is being cleaned down appropriately and disinfected, right? So if we were to leave 4 poll workers in their 60s and 70s at a church basement polling location and basically give them hand sanitizer and disinfectant and say, good luck, I have no way of guaranteeing that was going to happen, right? So this is the model that we used for the primary, which is large vote centers, open the area up, decrease the number of locations you have, but ultimately increase the size of the locations that you do have. And, you know, we were really fortunate. At the end of the day, we had no reported cases of community spread during our election. During the primary election, we were able to vote over 1 million voters, which was a record high turnout for primary elections in Kentucky, going back decades. So not only did we break decades old records of voter turnout, but, we did it during a pandemic, and we did it in a way that ultimately led to no community spread, which to me, it's still it makes me sick to my stomach, but also makes me just happy on the inside that we made positive changes that affected people's health and lives. So, that's kind of where we started the primary. We then moved that into the general election. We took that same model, but what we said this time is, let's open up some more locations, because obviously the volume of a general election is going to be much higher. We're going from 30% turnout to between 60 and 70% turnout. So obviously that's going to be an issue. But what we also wanted to do is distribute the methodology of voting out. So in a traditional election in Kentucky, everyone votes on election day. That's basically it. 1.5% of voters traditionally in the past have used an absentee ballot. So an absentee ballot cast by mail. And then everyone else votes on election day, right? So if you do that, you've now condensed all these people under one point of failure, right? That if something goes wrong on election day, I can't fix it, right? So what we try to do is distribute the load of voting across 3 methodologies. One, we have an absentee portal that we created that allows voters to apply for an absentee ballot. And if a voter doesn't have internet access or a computer, we made it possible and legal for them to call the county clerk over phone and request an absentee ballot. We said that fear of COVID was a valid excuse for applying for an absentee ballot in Kentucky. We then created 3 weeks of early voting, no excuse. I'm excited that we just got these posters in a couple days ago, but voting early is the same as voting on election day. And we're really trying to push that out as heavy as we can because we really want people to take advantage of early voting. The more people that vote on early voting, the less pressure will be on election day, which again, like I said, we can pivot early voting and mail. It's hard to pivot on election day itself. So the goal has been to distribute the load evenly across those three methodologies of voting. So absentee mail, early voting, and election day. And right now we're on target. We're a little over 1 million votes have been cast thus far. About 450,000 roughly votes have come in by absentee mail. We're expecting that number to come up to about 615,000 ultimately when it's all said and done, with right now about 550,000 early votes. Now, yesterday, that number was almost 100,000, which makes me really excited because now it's roughly 650,000 that we've had. So that first number was from the weekend when we broke the numbers down on Sunday. But I'm really confident right now. I'm really optimistic about this election. Obviously, there are always problems and fires that we have to put out along the way. One of those was getting enough PPE for everyone, making sure that it's distributed down to the counties and ultimately the voters and poll workers and administrators. So, I think maybe if you want, we can talk a little bit about, I'm thinking maybe we can do this. Let me see if I can't share my screen real quick. I'll show you the document that we sent out to the counties for safe and healthy voting guidelines.
Mhm.
And then maybe talk about that for a couple seconds, and then we can
Yeah.
open up for questions. Sorry, technical difficulties.
That's okay. For anything like me, I usually have 15 different documents up and can't find the one I want to show.
It's actually not allowing me to show my screen. It's asking me if I
What's
want to.
not?
Yeah.
Let's see.
Let me see if I can make you a co-host real quick. Give me just a second. Now try it.
Nope.
Still won't.
Yeah.
Huh.
Sorry. Let me try this real quick. My apologies.
That's okay.
Let me see if this will work.
If you want to, you can send it to me. Oh, there you go. You got it. Except we're just seeing
Blank.
like a whiteboard at the moment.
Yeah.
Are you comfortable sending it to me? You can email it in the chat. I put pam.yankulov@louisville.edu in the chat. If you can grab it there, and then you can send it to me. And I can share.
There we go. All right, you should receive that right now.
Okay, great. Let's see. Okay. Of course, my system is scanning it for viruses right now.
While you do that, why don't I go over just a couple of brief things? So I know, so some of the questions that we got immediately were kind of how do you balance what is a constitutional right to be able to vote during a pandemic? And that's one of the things that we had to kind of come to grips with. How would that necessarily work? So what we decided on was that ultimately, being a poll worker is a privilege, not a right. Being a voter is a right, not a privilege. So what we mandated was that counties had to have all their administrators and poll workers wearing masks. But if a voter ultimately comes in and demands not to wear a mask, we ultimately cannot put a barrier in front of them to be able to cast a ballot. Now, ultimately, that is obviously is very frustrating and disheartening that, you know, we have members of our own community that are unwilling to step up and help protect others while they're voting as well. What we try to do is work with the clerks to get that person in and out as effectively as possible. We've provided over 10% of the overall population of in-person voting. We provided masks out of the state stockpile. So if someone shows up without a mask, they're offered one. Ultimately, again, we can't force them to wear that. You know, we are trying to do our best to make sure that the poll workers themselves are limiting that ability of a voter that maybe comes in without a mask to continue to spread that across the entire room. So sometimes we have them, we'll be working on a separate side of the room. They'll oftentimes, sometimes even work outside the polling location itself, bringing a ballot out to that voter outside. So the clerks are being really creative in this process. All right, so you're up. Awesome.
Yeah, there you go.
So you'll have to scroll for me, I guess, but
Sure.
if you want, what I will say is what we started with is best practices from around the country, from other states, obviously CDC guidelines, state of Kentucky guidelines, and we work directly with Secretary Eric Freelander at CHFS to kind of model these, put them together, and then ultimately get them out to the counties for them to use for guidelines for voting. So if you want to scroll down, I'll kind of briefly hit the high point. So this part is absentee mail. So we wanted to talk about how when you're accepting mail back in, there are a lot of, especially during the primary, there were so many unknowns about the virus that we didn't really have a good grasp. You know, can someone get COVID by touching the same materials, right? So we now know that paper transmission is fairly rare. And ultimately, it does not last as long on a paper environment that it would aerosoled in the air. So, you know, what we've kind of given the clerks some guidelines of telling them to put them in quarantine for a day. But usually if it's mailed back, by the time it gets back to the county, it's already gone past that. Some counties are just processing them a day later. You know, what we wanted to avoid was counties taking Lysol and literally spraying every single one of them down. It would wet the ballots, it would create problems. And so ultimately we just wanted time and open air to be the best disinfectant when it comes to paper products. So if you want to scroll down a little more, this kind of goes into, you know, how elections officials and pre-existing election officials should be behaving. You know, both modeling good behavior, checking temperatures as they come in, making sure if they have symptoms, they're not coming into the polling location. If they are tested positive, that they're notifying the state board and the county administrators as soon as possible. We're working directly with county health departments to go in and do deep cleans of polling locations when that does happen. Unfortunately, it has happened a couple times. We haven't seen any community spread from it because, again, we're asking our poll workers to wear masks, to wear face shields, to be behind sneeze guards, and to disinfect when possible, hand sanitize, hand wash. All of those things in conjunction together, I think, are creating a safe environment that even if someone is positive and they're not sure, they don't know that yet, that they're not effectively transmitting it in these short periods of times that the voters are coming in and out of the location. And ultimately, you know, if we get them tested and out, you know, and then we clean the location down thoroughly on a regular basis, that's hopefully going to decrease the amount of community spread, if any at all. And again, the hope is that we have another safe record like we did in the primary. You can scroll down a little more. So again, it's a lot of details here. You feel free to share this if you'd like, but again, it's a lot of details on just, you know, social distancing, on wearing face coverings, you know, how best to interact. If you want to scroll down a little more.
The next page or?
Yeah, next page is fine.
Okay.
So obviously this is, if you want to go down just a little bit more on the bottom half. So a big part of the question is we have a lot of equipment, right? So voters have to touch things and then they leave and then the next voter comes in and touches that same thing, right? So one of the first things we did, it was one of the oddest purchases I've ever made in my career. I bought, how many did I buy? I bought 800,000 pens, which was a very odd purchase. So I had to find multiple vendors that would be willing to sell me in quantities of that much, while other states are doing the exact same thing. And that's been a big problem that a lot of the states have had is logistics. We're all purchasing from the same vendors, right? So we're purchasing ballot paper from the same people. We're purchasing pens and equipment, and all of that is being done at the exact same logistics timing. So this portion that is on the page right now, this is kind of how people should be using their equipment, wiping it down, sanitizing it, and also doing it in a way that's not going to destroy the equipment, right? If you were to take an alcohol spray and spray it onto either an LCD screen or a piece of equipment that was permeable, that had spaces where the keys are, and that liquid was to get in there, obviously it's electronics, that could damage very, very expensive equipment. And ultimately, that was one of the things we wanted to avoid. But we also wanted to make sure that, from voter to voter, that they were helping us. We did mobilize the National Guard. They were in non-uniform. They were only in a support capacity. So at no point was a National Guard member checking a voter in, checking ballots. They weren't having anything to do with the election systems themselves. Rather, what we had them doing was what their normal function is, which is what I like to say is, when there's a natural disaster, National Guard is called up to put proverbial sandbags or literal sandbags around our businesses and our homes to keep us safe. And during the election, what we did is have them build sandbags around voters and poll workers. So we used the Guard to clean and disinfect locations down in between voting. We used them to make sure that the locations were being cleaned effectively and that they were trained appropriately. Easier to train National Guard than it is, thousands of poll workers. So that was one way that we did that. And again, just kind of general things of how many things people have to touch in a voting experience. If you want to scroll down a little more. So this portion is kind of how we treat with voters, right? So again, voting is a fundamental right, and all lawful and qualified registered voters must be allowed to exercise their right to vote at their polling place on election day if they have not previously taken advantage of absentee voting or mail-in voting in person. So again, while it would be my hope that all voters would wear masks, that would social distance, that would be appropriate, we know that's not necessarily going to be the case with all voters. So we try to put that person in a little bit of a bubble. Right. So we can't force them to wear a mask, but what we can do is make sure that they're not interacting in a long-term, in confined setting with other people, other administrators, poll workers, and voters. So if you want to go down. Trying to make sure that, this just kind of talks about signage, voters knowing what their rights are, poll workers knowing what they're required of them. Making sure that, just like all safety guidelines that we're telling people, reminding them, disinfect your hands, wash your hands whenever possible, just normal guidelines. Again, this kind of goes back to how do you set up a polling location? How do you effectively allow people to social distance? We asked a lot of the counties, Jefferson was lucky because they have the state expo fairgrounds to be able to utilize, but not all counties, especially small counties, have locations like that. So what we recommended was cafeterias, school cafeterias. They tend to be built to have ingress and egress that is in two different locations. So you don't have people coming in and leaving cross, I guess, I want to say pollinating, but like cross touching each other as they come in and out. But a cafeteria is also built with non-permeable surfaces so that you can clean it and disinfect it effectively. It's fairly pretty large. It's almost always a large open area. And so what we recommend to a lot of counties is they use their school cafeterias to be able to do that. But again, we worked with the counties directly to be able to set up voting locations that were effective, that could get people in and out smoothly and quickly, and have both a secure and safe voting experience. If you want to scroll down again. So in the state of Kentucky, we have what we call precinct challengers. It is the parties are allowed to nominate 2 people per location. Originally, it's actually the law states 2 people per precinct, but now we have voting locations that have 600 precincts in one location, right? So clearly having 1,200 challengers in one location is not going to be safe for anyone. So the board took this into account in their emergency regulations, and we stipulated that each party is allowed to have 2 challengers per location, not per precinct. We also make sure that they are also complying to CDC guidelines, safe voting practices, wearing masks at all time, social distancing, not coming in direct contact with election equipment or other voters. And I think that might be, is that the last?
7 of 7. Uh-huh. Yeah.
So that's it.
Great. Well, thank you so much. It's been quite a fascinating experience and a very interesting job that you had for the last year, trying to keep all of us safe and supporting our interest in all.
And it was a lot of information real quick, so I apologize. But
happy
to open up questions.
Yeah. Sam, are there any questions? Let's see.
I am pulling up the chat right now. If anybody has any new questions to put in the chat, we would also invite you to turn on your camera or unmute yourself and ask any questions that you might have as well. I see that Samira had a great comment about so many things that we should consider that we often take for granted. So
there is a question. It says that there's an individual that says, I'm joining as a caregiver, Gary, for one of Traeger's patients. And I'm wondering if someone with mild dementia can be allowed to vote with some assistance.
So if a person's rights have not been removed from them, if someone is deemed mentally incompetent, there's a court proceeding that the court, that usually a family will go through in that process, and that voters' rights are taken away. Obviously taking away a voter's rights is something that is incredibly serious, that you have to be incredibly thoughtful about. But also as a caregiver, one of the things that we oftentimes that we see is an individual whose rights were not taken away when maybe there was some question of whether they should or should not have. And now you've got a family member who is incredibly well-intentioned who ends up assisting that voter in casting that ballot. And ultimately the question that we usually have is the voter filling the ballot out, casting those votes, or is it ultimately the caregiver that is, wants their family member to be taking part in a process that they've always taken, great value in and have always participated in. Now they're feeling if they don't vote, then they're taking that away from them somehow, even though when mentally and cognitively they might not be there. Again, it's got to be a case-by-case situation. And as a caregiver, I would just caution everyone to make sure that, if you are making sure that person has access to the ballot, absolutely appropriate. But making sure that you're doing it in a way that it's the voter that's making those decisions and not the caregiver. And so sometimes that could be situationally, contextually, that question just needs to be asked. And so I don't know if I can give you a straight yes or no answer to that, but again, it's contextual, and ultimately, if there's 2 questions there, one is should that person be voting if they are, if they're suffering with dementia, and if they can do it on their own, then great, absolutely. If they have to do it with so much assistance that there's a question of whether that voter is actually casting that ballot, then maybe that's something that you would take a little pause on and talk to your local county clerk about.
Thank you for that. You see on the news all the time the long lines, and I always wondered what those images, why we have these such long lines. So thank you for sharing all of the experiences, because I was so about that.
Honestly, there's multiple reasons why we have long lines in any election. Oftentimes it's just pure volume. Other times it's the size of the ballot. This ballot face, I'm not sure how many people have voted already, but if you got your ballot, you saw that it was not only a huge ballot on the front side, but on the back side, there were constitutional amendments as well. That takes time. But we've taken a lot of steps in Kentucky to streamline that check-in process. So we went from paper roster books to e-poll books. And to be frank, the e-poll books actually were one of the safest things that we had that we implemented for the last election, which is in a traditional election, you've got these big paper books that you have to, every name is on there. You have to fold through them. It's paper. You've got voters are going to touch it, write on it. The next voter is going to come in, touch on it, write on it. How do you effectively disinfect paper when you're talking about minutes of usage? The e-poll books are great because they're iPads. iPads have a antibacterial film that's already attached to them, so they just need to be wiped down and disinfected. So, that helped with the processing. It went from an average of 2-minute check-in time to 45 seconds. So for us, that added a lot of value in making sure our lines were not long. In the primary election, we did not see many lines at all. I think Fayette had some lines, but they were able to increase the number of poll books they had at check-in, and ultimately those lines decreased down. Jefferson, I'm excited to say, had 15,000 voters vote at that expo center without a single line the entire day. Now, at the end of the day, there were some people that showed up at the last minute to vote, and unfortunately, there's a law in Kentucky that the doors close at 6 p.m. at the close of the election. If there is a line, then a poll worker stands at the end of the line, and no one else can come in. But there's no line. So we found there's a lot of people that were coming in. They got there late, and ultimately, there's a circuit judge on duty in every county. As a pressure relief valve, just in case there are issues. And they were able to say, hey, these voters made a good faith effort to get here. We'll let them in. And there were about 100 voters that were able to cast a ballot at the end of the night. But the reason why I bring that up is because, anyone who shows up at 5:59 to vote when the polls close at 6, that is not an effective plan to cast a ballot. Right now, I'm not saying they shouldn't vote at all. I'm saying absolutely they should. That is everyone's constitutional right, that if the polls are open, that you can go, you can get a ballot, you can cast your ballot. And ultimately those voters did. But when we talk to voters, we always tell them, have a plan to vote. What is an effective plan to vote? How do you vote safely? How do you vote effectively? And for our recommendation to voters is you do it early, right? Like, don't wait until election day when you don't know the size of the lines. You don't know how many people are going to be there. What we're seeing right now in the counties for early voting is literally, 5 and 10 minutes in and out, and you've cast your ballot. And you've done your part to protect your community and your family and yourself.
I was also looking at the national news, and they were talking about how it is that some of the ballots are not going to be accepted due to whatever it is, the signature doesn't match. So are our ballots being opened and looked at, or are they just being counted at this time in Kentucky?
So Kentucky, so it's interesting. So we stood up a lot of different both technology measures and security measures. So my background is in engineering. My degree's from University of California, Berkeley in engineering, and it's kind of, I'm an outlier to most of my peers. Most of my peers are attorneys. I come to this from an engineering background, but for me, it's systems analysis. And so I love the idea of these things are giant puzzles for me. And so one of the things that we've done is we've added a lot of back-end support systems for our absentee mail process. So a lot of people think about absentee mail and they think about the system that was implemented in the 60s and 70s. That's not how we vote today. So today we have a portal. I can track exactly when someone applies. The state will then print a ballot label, and that label has a barcode on it. We actually print 3 of them for the 3 envelopes that go out. The county still has a role, so that's a check and balance on both the state and the county. So only the state can print a label, only the county can pack the ballot and send it out to the voter. But when we do that, we can track now through the mail from the point where the application was submitted by the voter, when the ballot arrives at the county clerk's office to be packed, when that envelope goes out into the mail, and when it's delivered to the voter, when the voter delivers it back to the county clerk's office. And then there's now 2 envelopes. There's a outer envelope, which is what the voter will put what we call the security envelope in. It's the yellow, hang on a second. So this is a security envelope. So What we have is the envelope portion itself where you'll insert your ballot here. You'll seal it and sign it. This is a detachable flap that in very large, bold red print that says do not detach. For some reason, people still do. And that is for secrecy for your own ballot. So when it comes back, your signature will be on this line right here. Those signatures are checked. We use both your driver's license and or your voter registration card to validate that. So we usually tell voters to make sure that your signature closely resembles your driver's license signature. Once that's done, there is a team of processors at every county that is going through. They're opening the outer envelope, they're checking for the signature, and then once they've checked it and verified it, what they'll do is they'll remove that flap. So now you've got a flap that has a signature. They'll take that goes to the side, and now you have a ballot that is both secret and unknown with a valid ballot inside of it. That then gets sent to a different processing team where they then open that ballot, pull it out, and then they tabulate it ultimately for the voter, for the vote count itself. So that way there's still secrecy inside the system. But the benefit of having a barcode system is that we can track it all the way through that system. We can track it from the point where the application is done to ultimately when that ballot gets submitted inside the tabulation machine.
So do you wait till November 3rd to actually open the
No.
Yeah.
I think it's important that everyone understands that every state has different laws when it comes to their elections, right? We're a distributed system that every state has varying laws and mechanisms that they use to effectuate their election. So for Kentucky, on traditional election, you can only open an absentee ballot, count it, process it on election day. Well, when you're going from 1.5% of your ballots to, in the primary election, 75% of your ballots, right? You can't do that effectively on one day. So in the primary election and the general election, for example, the general election, we started processing October 1st. So the counties have already been checking signatures, opening ballots, making sure that they're valid. If there's any irregularities, we contact the voter both through email and a letter, and then the clerk oftentimes can call that voter. Out of the 500,000+ ballots that have been returned already, we're only at 1,000 irregularities. So only 1,000 ballots have been declared as irregular or not valid. And of that 1,000, over 400 have already cured that ballot, meaning that the voter was contacted. They were told, hey, there was a problem with your ballot. That voter then went in and cured the problem, whatever that was, and we're able to effectively cast that ballot.
Thank you.
So,
I think a few more questions. That's great. Thank you.
Please. Yeah.
Sam, did you want to ask a few more? Is there a few more questions in there?
Yeah, so one of the questions is, are there current plans to have law enforcement present on election day?
So law enforcement is always present on election day. Most people just don't know that because they blend into the background for the most part. The county sheriff is a member of the county board of elections in every single county, and they're there for a specific reason. One, as a first responder, if there are problems at the location, polling location itself, or if there are issues going that law enforcement officer is there to be able to communicate with our other law enforcement partners.
There's another one.
Yeah, there's another question. Do you think some of the changes we've had to incorporate to make the election safe during COVID-19, like e-poll books, will stick for future elections?
So some of these things are changes in the law, some are changes in regulation and policy. And so e-poll books are here to stay. They were implemented, we started implementing e-poll books about 4 years ago, and we've been gradually phasing them in. What was a gradual phase in for e-poll books ultimately was, hey, everyone in the primary, we're all using e-poll books no matter what. So it was really the only way to have an effective election in the primary. And so every county is now completely 100% on e-poll books, which is a good thing. Again, it speeds that process up for both the voter and the poll worker. There are other things that are more statutory in nature. So early voting, we don't have a law that allows us to have early voting unless we have an emergency regulation that's passed by the board, the Secretary of State, and the governor. So as soon as this election is over, those laws that govern and gave us the ability to change the election will go away. But what I will say is this, is that I think that there were some really successful things that we saw in this election that hopefully we'll be able to take into General Assembly and have them change some of the laws around how our elections work. Now, my guess is we won't have 3 weeks of early voting. My guess is probably about a week. It's been highly successful across all demographics, both rural and urban. Democrat and Republican voters have all found a very easy, effective way of being able to cast their ballot. And I've already had several calls from legislators saying that they're getting back very positive feedback from their constituents. The portal I'm hoping to keep as well by statute. But so there are some things that we can keep by regulation and some things that will have to be changed in statute. So, but we don't have an election for another 18 months. Thank God. I am going to take a very, very long nap after this election is over. But that means we also have time to basically go back and take a look and, do a postmortem on the election. What worked well, what didn't work well, what things were statutory need change, what things are regulatory, and what things we can change by policy.
I was also looking at the national news, and they were talking about, I guess they were challengers that were looking at multiple ballots being dropped in a mailbox and how that is against that. One person can drop a ballot in a mailbox. And then I guess it was in Pennsylvania, and they were saying that that if you were disabled, you could have your ballot dropped off by another individual. Is there anything like that in Kentucky?
So Kentucky's a little gray when it comes to that. Under a current condition, the voter, it's the goal is that the voter is the only person dealing with their ballot and that they're submitting it by mail. It's the only way to deliver it. In this election, we've increased the ability for voters to be able to drop it off with multiple methodologies. So one, we have drop boxes in every single county, so you don't have to use the Postal Service if you don't want to. We've found the Postal Service to be a very effective and appropriate partner. They work bend over backwards to help us to make sure these ballots are delivered timely and effectively. But we also want to make sure voters have the ability to drop it off in a drop box if that suited their needs. But during a pandemic, we also know that if someone's in quarantine, we don't want that person leaving their house to be able to go out. So we expanded some of the laws on who can deliver a ballot for that voter themselves. But again, an absentee ballot is in a security envelope that's placed inside of an outer envelope. And all those things are reviewed when they're processed. So if a ballot's been tampered with, if it's been damaged, that will generate what we call a cure letter, notifying the voter that, hey, there was an issue with your ballot. We need you to contact us and cure this.
Do you know if multiple or more individuals were likely to do the mailbox versus the poll box this year?
We're seeing higher usage of the drop boxes in this election than we did in the primary election. So I think it's, unfortunately, there's a lot of misinformation, both from the left and the right, about whether that's voting or whether it's about the Postal Service or just what the process is and what it looks like. We're seeing misinformation come out from both foreign nation states as well as domestic actors as well, unfortunately.
Mm-hmm. I have one more question. Is there any more questions, Sam?
No, there's no more in the chat at the moment.
Okay. So the challengers, can you talk about what generally do the challengers actually comment on and when they're watching?
So this is actually kind of I wouldn't say an antiquated law, but it is a part of the process. And understanding that in Kentucky's election history, that we did not have the most secure elections in the world. There was a lot of vote buying that took place in the 50s and 60s and well into the 70s. There were people that unfortunately there wasn't a lot of governance over our elections in decades past. I'm talking about a generation back, so not our current elections. And not our current generation of elections. So we have some laws that are still kind of vestigials of kind of old processes, and one of those is a poll challenger. So a challenger by law, I think a lot of people think challengers are there to make sure that voters have access, but it's actually the exact opposite. A challenger is put there by the party to say, hey, that person's not eligible to vote. They're not registered. They've already voted. There's an issue with, vote buying or some other concern. These are problems that largely we've been able to stamp out of the system over the past couple of decades, with both new controls as well as more governance over the counties, more state access into the system. So a lot of those things have been cleared up from a process thought, like policy. I guess I'm losing my train of thought here, but we've been able to effectuate a lot of changes in the system by policy and regulation and law. But what we still have is some of those safeguards that were there left over from the old system. And so challengers are part of that older system. Now, in my mind, a challenger, if they're there effectively, can be there as a checks and balance on the county, on the state, on voters. But the question is whether they're there and are they interrupting voting? If they're interrupting voting, there are laws that allow the county clerks to remove those people and eject them from the polling location. But they do have, by statute, a place in the polling location, making sure that voters are there and that they're appropriately casting ballots. Which I know is probably a long-winded.
Have you heard any issues with challengers this year?
No, I will say, so I've been in my job for about 4 years now. And in the first 3 major elections that we had a total of 0 challengers that were submitted. This election, we do have some challengers. I believe Jefferson County had 10 Republican challengers, and I believe there were about 150 Democratic challengers that were sent to the polls. So, I think it depends from county to county, from race to race. They are a mechanism of the parties. So the parties have to nominate someone. They then send that list to the counties. They have to go through poll worker training, just like poll workers as well, to know what the laws and standards are. And then ultimately, like I said, we have 2 per location now, if they are submitted, if they are there. So.
Great. Thank you, Jared, so much for the fascinating conversation. And I do wish you some rest after all of this is over. and I did want you to know, we are going to be posting this taping on our U of L Traeger, and we can send you that information as long. And we were also hoping we can post the handout with the
taping.
Yeah. Okay, great. All right. So thank you so much. And I just want to end today by saying that we also have some upcoming sessions. We have November 10th is going to be COVID and the long haulers with Dr. Arundi Botnacker of University of Louisville School of Medicine. And then we have November 24th, we have COVID-19 and wastewater with Dr. Rochelle Holm of the Co-Immunity Project. So I thank everyone for coming, listening, and Jared, once again, it was really amazing. Thank you so much.
Thanks for having me.
Thank
Appreciate it.
For all
you guys have a good day.
All right. Bye-bye.